2023 was arguably the warmest year ever recorded in the U.S., with temperatures recorded as high as 118 degrees Fahrenheit in Phoenix, Arizona. And according to the National Oceanic and Atmospheric Administration, there's a 77% chance that 2024 will break those records. Speaking of 2024's heat wave in the U.S., July has been recorded as the hottest month in the majority of U.S. states. Texas recorded the highest temperature of 120 degrees Fahrenheit. Louisiana had 114 degrees, Florida 109 degrees, Oklahoma 120 degrees, and Arizona recorded a temperature as high as 128 degrees Fahrenheit. It's not over yet, and Southern California and western and southwestern U.S. states, including Arizona, Las Vegas, New Mexico, Colorado, Nevada, and Oklahoma, are still expected to see temperatures of over 100 degrees this month. How to survive this seemingly everlasting heat wave? And what to do if you or someone around you suffers a heat stroke? Let's find out in this video. First of all, let's see what actually a heat stroke is and what happens to someone who has a heat stroke. Similar to the radiator of your car that has water running inside the tubes and keeps the car from overheating too much, our bodies have a natural cooling system. Similar to a car's engine, our bodies naturally produce heat as every cell in our body utilizes glucose and produces energy to keep us going. Similarly, when we digest our food, and as we move around and as the activity of our muscles increases, the amount of heat produced by the body also increases. This heat gets dissipated in the surrounding environment, but only when the surrounding temperature is less than our skin's temperature. When the body's heat is unable to dissipate, the temperature of the body starts increasing gradually. Our bodies also dissipate heat naturally when we exhale, because when we do that, we release hot air and water vapors out. Anyhow, as the body's temperature rises, this cooling system triggers the release of sweat to protect our internal systems from overheating. The more the heat, the more the sweat. And when the sweat evaporates, we feel a cooling sensation. But there's another thing that makes it even difficult for our bodies to cool down: humidity. As the humidity increases, the amount of water vapors in the atmosphere increases, making it difficult for our sweat to evaporate. That's when we feel more heat compared to the surrounding temperature, and that's why you notice the feel-like temperature to be more than the actual temperature in weather apps. Anyhow, to compensate for this effect, our body releases more sweat but still keeps getting hotter unless you take steps to cool it down with a fan or an air conditioner or water. Heat stroke happens when the body's temperature rises above 104 degrees Fahrenheit or 40 degrees Celsius. Here are some signs and symptoms of a heat stroke that will help you know if you or someone is having a heat stroke. Number 1. Feeling thirsty. Thirst is our body's natural response to heat, dehydration, or lack of fluids inside. In heat stroke, thirst is often intense and sudden and may not go away by simply drinking water. You may also be surprised to know that a person having a heat stroke may begin to shiver or feel cold despite sweating. This can be dangerous and even fatal if not addressed on time. Despite the sensation of cold, the person's body still needs to be cooled. If the person is conscious but shivering, avoid giving them fluids orally, as this can be dangerous if their mental status is impaired. Number 2. Feeling confused or dizzy. The person having or about to have a heat stroke may seem disoriented, unable to focus, or dizzy. They may also seem to lose balance, stumble, or have slurred speech. In severe heat stroke cases, the person may also start having convulsions or seizures. Number 3. Nausea and vomiting. These signs often show up with dizziness and feelings of confusion. The person may feel nauseated or suddenly throw up. Vomiting causes fluid loss, which can further worsen the signs of heat stroke. Number 4. Hot and flushed skin. Even if the person was sweating earlier but not anymore, and their skin looks dry but hot and flushed, then it could be a sign of a heat stroke. You may also notice their tongue looking dry and swollen. Number 5. Rapid heartbeat. When someone has a heat stroke, their body increases their heart rate in response to intense heat, trying to dissipate heat by increasing blood flow throughout the body. Studies show that heart rate in a person going through heat stroke or exhaustion can go as high as 160 beats per minute and 120 beats per minute on average. Rapid heart rate can be an early sign of heat stroke, so recognizing it on time can help save your life or the life of someone near you. Number 6. Rapid, shallow breathing. The average breathing rate for a normal healthy person is around 12 to 18 breaths per minute, but for a person having a heat stroke, it can exceed 20 breaths per minute. While rapid breathing usually happens in panic attacks, in heat stroke, it is coupled with an elevated body temperature, flushed skin, and other signs of severe heat stress. Remember that these signs of heat stroke, although can affect anyone of any age, they can be pretty intense and sometimes even life-threatening in older people, especially those with specific health conditions. For example, people with pre-existing heart disease, hypertension, and poor blood circulation are at high risk of developing heat stroke. In fact, high heat and extreme exhaustion can also trigger a heart attack or an actual stroke in such people. Another group that's more likely to be affected by ongoing heat waves is the one with diabetes. High blood sugar, as you know, tends to cause thirst, urination, and dehydration. Moreover, certain diabetes complications, such as nerve damage and blood vessel damage due to high blood sugar, can affect the way your body cools itself down in hot weather. Another high-risk group for heat stroke is the one with obese people. Excess body fat acts as insulation, making it harder for the body to dissipate heat. Obesity also puts extra strain on the cardiovascular system during heat exposure. Besides these, people with conditions like CKD, asthma, COPD, hyperthyroidism, mental health disorders, and neurological disorders should be very careful about going outdoors in hot weather. Now, let's have a brief look at what should you do if you or someone near you has a heat stroke. Number 1. Call 911 or emergency services immediately. Simply cooling the person does not replace the need for professional medical evaluation and treatment. Heat stroke requires urgent medical attention. Do not wait for symptoms to improve on their own. Number 2. While waiting for the ambulance, move the person into a cooler, shaded, or air-conditioned space. If indoors, move them to a cool room and away from heat sources. Number 3. Loosen their clothes and strip them off if needed to help the body cool down. Number 4. Use cool water, but not ice-cold water to douse the body. A cool shower, bath, or hose can also help. Focus on areas with large blood vessels near the skin, such as the neck, armpits, and groin, where cooling is most effective. Number 5. If water is not available, place ice packs or cold, wet towels on the neck, armpits, and groin to speed up cooling. Avoid placing ice directly on the skin as it can cause frostbite. Number 6. Hydrate with caution. If the person is conscious and not vomiting, offer cool water or an electrolyte solution. But avoid giving fluids if the person is confused, vomiting, or unable to swallow. Do not give alcohol or caffeinated drinks, as they can worsen dehydration. Remember, sodas, colas, and other similar drinks tend to increase dehydration, so never give any such thing to a person having a heat stroke. Most importantly, while cooling is critical, sudden immersion in ice-cold water can cause shock or cardiac arrest, especially in older adults or those with existing heart conditions. So be careful. To protect yourself from heat stroke, first of all, keep yourself always hydrated. Again, avoid drinking energy drinks, sodas, colas, caffeinated teas, coffee, alcohol, and even processed fruit juices that contain too much added sugar. Instead, you can drink plain water, caffeine-free iced tea, lemon mint water, coconut water, cucumber lemon-infused water, watermelon juice, beetroot juice, or lemon juice. Food choice also matters when it comes to hot weather. Foods like fried chicken, burgers, and other heavy meals need more water to digest and generate extra heat within the body during digestion. Chips, processed meats, canned soups, and other high-sodium foods can lead to dehydration, as salt causes the body to retain water and increases thirst. While some cultures consume spicy foods to induce sweating and cool the body, in extreme heat, spicy foods can increase body temperature, cause discomfort, and may lead to dehydration for some people. Instead, prefer organic water-packed foods over cooked or fried foods. Watermelon, cucumbers, and strawberries are over 90% water, helping keep you hydrated and providing essential vitamins and minerals. Cantaloupe, oranges, and pineapple offer high water content along with electrolytes like potassium, which helps regulate fluid balance. Berries and leafy greens are among the best options that help you stay energetic while helping your body stay calm and cool. In the intense heat wave, it is vitally important to stay hydrated. Nature has provided us with certain foods that can be extremely helpful in keeping you hydrated. Stay hydrated, stay healthy.